Hey guys, today I'm going to teach you how to properly set up a filling procedure. This is one of the easier procedures to set up, and it gives you a good head start on what to expect when setting up for really any procedure. So let's get into it. So the first thing we're going to do is check the tooth number or numbers and the surfaces that we are going to be filling today. The first way to go about this is just to look directly at their chart. And here it shows that there are incisive cavities, also multi-surface cavities, upper and lower. And in this case, actually, we were filling this entire right side of the patient's mouth. And I'm going to show you multiple different examples of this. This is another patient's example. You can also look on the front of the route slip and make sure that they correspond with each other. Double check the schedule as well and make sure everything is corresponding with each other. I put a filter on myself for HIPAA protection here. Also should mention that you should always double check with your patient the treatment that we are doing for that day. Make sure that they fully understand what we are doing before proceeding. Alright, so now we're ready to gather our supplies. I made it easy by creating a checklist. So we'll start in sterilization, where we gather our restorative tray, hand pieces, articulating paper, tray paper, Garrison and rings, and mandrel and discs. You can find your restorative trays up in the cupboard, depending on which office you're at. And this is kind of what a restorative tray looks like. It's kind of wrapped up, so I'll show you some different examples. In Hilliard, our restorative tray looks green versus the root canal tray, which is a deep blue color. In Westerville, our restorative tray is more of a bluish greenish color versus the root canal tray, which is a gray color. So we'll grab the bluish greenish restorative tray, as well as our hand pieces and our Garrison, which is in the same drawer. And then we'll grab some articulating paper. Normally we only grab one, but for this particular case, I'm going to grab two. And then from here, we're also going to grab some discs and a mandrel. When selecting discs and a mandrel, make sure we are grabbing one of each color of the discs. Starting with the black. The black is the coarsest of all the discs, and it goes from black to purple to green to pink. Pink being the finest. It's more like a polisher, and we use these particularly for anterior fillings. And since in this case there are two anterior fills, we're going to grab a couple of discs here. Also below the discs, I did want to mention, are the interproximal strips, which are great for smoothing interproximally when you can't really reach with a burr. We're not going to use it for this particular case, but it's good to know just in case somebody asks you for them. And we're ready to set up our room. This part is pretty self-explanatory, just laying things out where they should go. Tray paper to the side, articulating paper on the assistant side, putting the tray paper on the extended tray, as well as the hand pieces. Also placing the suction tips on the actual suctions on the assistant side. Like I said, pretty self-explanatory. And I will get into the actual setup. So we are going to set up a complex setup so that you can kind of get a feel for where everything needs to go, and the usage of everything. So it makes it easier to understand when it comes to basic setups. This is a basic setup. This is basically set up for an occlusal filling, which is one of the most simplest fillings that you can do. So refocusing on the complex setup, we will start by setting up the bands and wedges. Since we are doing a lot of fillings, we are going to be using everything on this checklist, and we'll go over all the usages and placements and all that good stuff. Starting off strong, we have all of our matrices, anything that we ever need in this bands and wedges box, and I'll go over everything. So we'll start off with the beans. The beans go with the Garrison. We always use beans for only posterior teeth. So top to bottom we have the green bean, which is universal. You'll see FDAs or doctors using this most of the time. The purple bean is for premolars or for shorter teeth. And then the blue bean is our extended bean when the prep just goes subgingivally. And these always, always, always go with wedges and always go with the Garrison and ring. They will never be alone. Like I said, beans are typically used in cases like this one where there are interproximal posterior fillings. And since this is a complex setup, we have them upper and lower, so we're going to get out plenty of them. For this case, I got out mostly green beans for our F. And in this particular box, the wedges are right below the beans and the articulating paper. So make sure you get out plenty of those when using any kind of beans. Next, we're hopping into the Toffelmeier matrices. So top to bottom, we have the universal band. The middle one is the extended band, and then the bottom one is the pedo band, used on really only children or small teeth. We'll get out a couple of those, and typically we use these when there are plenty of back-to-backs or a bunch of class 2s like MODs that require more stabilization than using just beans. Moving right along for the Mylar matrices, these are typically used when we are restoring anterior fillings or the fillings in the front, and you'll always get out a wedge with these as well. And these are typically used when you need a very, very smooth surface, especially when it comes to anterior fills. And these are always paired with mandrel and discs and occasionally the interproximal strips. Alrighty, so that's it for bands and wedges for now. So hopping into the regular setup stuff, I've compiled an extensive list of what you need when it comes to any kind of fillings. So we'll start off with our shade guide, and typically we'll use this for anterior fillings when selecting shades. When you have a shade guide, normally we're using regular composite, and in this case I believe that we were using Omnichroma, which is a universal kind of composite. Really blends in nicely with surrounding tooth structure, but if there is no tooth structure for it to blend in with, we would select a regular shade. So Omnichroma has the white tip, so just keep that in mind. Some things that you will always have for fillings will be the composite gun. We keep our Sure-Fill in here most of the time, as well as the Dapendish or the bonding well, whatever you want to call it. We put bond in here. This is the one-step clear fill bond, which we've been using a lot more frequently. But if you don't see that, typically you'll see the two-step, which is a prime and bond. And again, these are always used in every single filling setup. Next, we have our dry angles, which are great for cheek retraction as well as moisture control, especially when working alone. We have our light covers, and we use our curing lights in every single restorative setup. So we'll grab a couple of those. Next, we'll get into some of the extra stuff. For example, a Viscostat, which is like a gelatinous kind of product. It stops heme or blood. It'll look clear or stiff. It'll have the yellow brush tip on the very end. Next, we have our etchant, which we typically use with anterior fills or shallow fillings that don't really require much prep. And this will also be kind of like a stiff liquid material, and it'll be blue. Lastly, we have our liner, which will come in either Limelight or this brown packaging, and it's used to fill the deepest parts of a cavity, especially when the filling is very deep. Also helps with sensitivity, and it's placed prior to the filling. And make sure we're not wasting products. We don't want to waste stuff like bond, but we can always set out extra stuff like Sure-Fill, Sonic Fill, stuff like that. Next, we'll get out some 2x2s, and then we'll start getting out our composite like Sonic Fill, which is our bulk fill, and Sure-Fill, which is white, which is what we use to line the bottom of cavities. And we can't use bond without our micro brushes, so we'll get out a couple of those just in case some of them fall on the floor or break or they get lost. Like I said, it's a complex setup. And then we'll get out some cotton rolls for moisture control and for cheek and tongue retraction. And this is what roughly the assistant side should look like once you are finished setting up. And again, this is for a complex setup. Last thing we'll need for any setup is anesthetic. And again, I have compiled a list of what you will need. So topical, cotton tip applicators, 2x2s, and then the needles and actual anesthetic carpules. Starting at the upper left, we have our extra short needles, which are used for infiltrating or for upper anterior fillings. And then we have our long needles, which are typically yellow. We use those when doing mandible blocks, or we're doing a lot of fillings on the bottom. So just remember lower, long. And then we have the short needles, which are on the bottom, which are used for everything else. We can use them for infiltrating. We can also use them for incisal blocks. It just depends on the situation. And then we actually have our anesthetic carpules to the right, top to bottom, septo, carbo, lido. Lido's red, carbo is beige, and then septo is gold. And they can be kind of hard to differentiate, so just really take a good look at them. And for this case, I'm going to get out at least one of each, and then your setup is done. Don't forget your sunglasses to protect your patient's eyes and everything. And this is roughly what a complex setup looks like. Also wanted to briefly mention, if for some reason you need suctions, like they fall on the floor, there will always be up in a cupboard or a little cubby, dependent on which office you are in. And that's how to set up fillings. So we went over all the uses and everything, so I kind of wanted to challenge you guys a little bit. I'm going to show you an example of a filling setup, and I want you to figure out what's missing. So we have 29 OD, 30 MOD, 31 MO, which are all posterior fillings. This is the setup that we are kind of working with here. So go ahead and pause the video, try to figure out what's missing, and when you are ready, go ahead and press play and see if you were right or if you were also missing some stuff. It's great practice. All right, so there was quite a few things missing. We were missing our suctions, Garrison and Ring, because we had beans out, micro brushes, liner, different anesthetic. We only had out Lido, Surefill 2x2s, and sunglasses. Did you get it right? Hopefully you did. The purpose of this exercise was to prepare you on what to look for when you were looking over your room before bringing your patient back for this kind of procedure. So this is what it should look like when you're ready. And make sure we always make it a point to check our setups before bringing back our patients. All right, say our entire procedure is done. What will our route slip look like? So this is what it will roughly look like. So make sure you fill out the assistant area with your initials, which doctor you worked with. Is it done as scheduled? In this case, it is. The room number you were in and their next visit. In this case, they're coming back for a 6-month recall. Otherwise, if they have any more treatment, you'll just put it on this line down here, along with the units and which doctor. Remember which kind of anesthetic that the doctor uses and try to fill out the bottom if you can. And then if you're doing anterior fills, make sure you write down which shade you used. In this case, we used Omnichroma. Now, if it was not done as scheduled, make sure you mark done with changes and mark whatever changes it was. In this case, let's say we added number 8 MIFL. We'll write that to the side as well as add it to the treatment so that the front desk can collect properly. And like I've stated before, if you have any questions, you can always let me or another team member know. We would be more than happy to answer anything that you may have any concerns or questions about. I know this was a lot of information. Hopefully I broke it down pretty simply for you. And thank you for watching.